presentation will cover tube positioning and repositioning, oral care, and cuff pressure checking. This is important for the following reasons. Number one, verification that the endotracheal tube is secure and in the proper position is one of the most important duties of the critical care therapist. So do this first. It's no exaggeration to say that an improperly positioned ET tube can be deadly. To prevent pressure ulcers, repositioning of the endotracheal tube to the opposite side of the mouth will be performed once a day. Good oral care is an important step in prevention of ventilator-associated pneumonia. Here's what the kits look like. Proper maintenance of cuff pressure is important to prevent the dreadful complications such as tracheal malacia. And now for the sequencing of those events. With the first ventilator check, you'll note the position of the endotracheal tube and record that centimeter mark at on the ventilator sheet. Before the next ventilator check, we will verify that the position of the endotracheal tube is correct on the chest x-ray. That's another presentation on how to read the chest x-ray. Also with the second ventilator check, we'll start performing our oral care. Before we do our cuff pressure check and our changing or repositioning of the ET tube, we'll need to do good pharyngeal care by using the short 14 French catheter. Oral care. We'll also reposition our tube with this vent check, and finally we'll do our cuff pressure check. For all subsequent checks that we'll do Q2 hour, we'll perform oral care. Note that the nurses do perform the first oral care with teeth brushing. Okay, I'm going to go over oral care. We use a kit that looks something like this, and inside this kit there is a liquid here. Now you might notice that on the Sage kits there's two different color liquids. Now the first one in the kit is a toothbrush. The nurses will use that with the first vent check in the morning. They'll use the one with the toothbrush. But we also have this one with the blue label on it. That liquid contains hydrogen peroxide and baking soda. And we'll alternate that with the one with the other alternating color label, and that has just like a mouthwash type of solution. Also, there are two swabs in here. One of the swabs has holes and can attach to suction, and there's some mouth moisturizer, and so we're going to use all these things. But we're going to start by opening the liquid in this little pouch right here, and you do that just like this. You squeeze it and pop. You hear that? And you can not only hear it, but you can see the liquid that's been released down in the bottom. And now I'm ready to open it up. I'll be sure to saturate my brush with the liquid, the blue liquid, and take it out. Now I have a swab, and the tip has been saturated with, in this case, the solution that I'm using is the peroxide. I'll take my Yonker device here, and I can simply, this is a Yonker by the way, a sleeved Yonker. By the way, we use these sleeved Yonkers. I recommend that if you run across a Yonker that's not sleeved, throw it away. Use these. But this can be disconnected, leaving just the blue handle in place. The blue handle has an on-off switch that applies suction. You can see I have it hooked up to suction. Now, connect my swab to there, and now I'm ready to go see my patient. And I'm going to swab this liquid around, and I'm going to turn my suction on and get it back out. Okay, here's my intubated patient, and I have this particular patient intubated, and I have a device holding the tube in place called a Hollister. And one thing I like about the Hollister, although it's not probably suitable for everyone, there's no real substitute for good old-fashioned tape sometimes, but this Hollister allows you to pinch and move the position of the tube. Before I do that, though, I'm going to use my swab, and I'm going to try to run this around in the mouth. I'm going to try to coat the tongue. I'm going to try to get the roof of the mouth around the teeth, although I'm not brushing the teeth, and the gums. And to cover that, and then right behind it, I can turn my suction on, and suction the liquid right back out. So this not only cleans the mouth, there's no rinse cycle, so to speak, with this. You just use the liquid, and it does foam up a little bit. The peroxide solution does. The mouthwash one does not, that we alternate with. After this has been done, I'm going to remove and I'm going to get another device. This device is a short 14 French catheter. See there? It's, what would you say, is about 9 inches long. And this catheter is made to clean out the oropharynx. I can follow along the side of the tube real carefully. Now, of course, patients don't like this at all, but I can follow along the side of the tube, turn on my suction, and I can get that area, the laryngopharynx area, which really is kind of impossible to get with the Yonker device by itself. So because of this flexibility and because it can go deeper, it has the ability. And I should do a deep maneuver, a maneuver to get the pharynx if I'm going to do cuff pressure, if I'm going to change my tube position. Anytime you do procedures like that, it's important to be real careful and get that area of the larynx, because this alone, the Yonker by itself, is too rigid to really get deep enough. This time is my second vent check around there. I've already checked my x-ray and I see that my tube position's good. So now I'm going to clean my mouth out. I've done oral care on this side. I'm going to move my tube to the other side of the mouth now. That's the great thing about this Hollister. You just unlock it and move it. And now I can do repeat the oral care and repeat the oral care on this side. Okay? Now after that's done, the next step is to go back to my kit. I'm going to take out the other swab, and I'm going to get this mouth moisturizer. I noticed the kit I have happened to have 2 brushes in there. I didn't realize this particular kit had 2 brushes. The mouth moisturizer will be coated. Of course, I'd have gloves on, but I'd coat my swab good with mouth moisturizer. The purpose of this is to coat all inside surfaces of the mouth. So after you've done oral care, and in this case I've done oral care, I've done a deep cleaning of the laryngopharynx with my catheter, and I've changed my cuff position. Now I'm going to follow along with my mouth moisturizer, and I'm going to coat all the surfaces on the inside of the mouth with this mouth moisturizer. Finally, after that's done, I can do my minimal leak or cuff pressure check.